This show is part of OnePlace, a daily network of focused briefings across the stories people follow most.
Welcome to our daily roundup. We have a packed episode today covering everything from high-level political ethics to the latest breakthroughs in medical science and global health emergencies. Let's get started.
Trump bought stock in a major obesity drug maker.
7 days of fasting triggers a total body transformation.
Nanotechnology successfully reversed Alzheimer's symptoms in laboratory mice.
Medically cleared children are getting stuck in hospitals.
The fiber-maxing trend offers significant proven health benefits.
Coffee's impact on blood pressure is only temporary.
Poor sleep and video scrolling create a dangerous loop.
Americans in Congo face high-risk exposure to Ebola.
First, the president's investments. Recent ethics disclosures have revealed that President Donald Trump purchased up to $680,000 in Eli Lilly stock earlier this year. This timing is particularly notable because it occurred while federal agencies under his administration were advancing policies that directly benefited the pharmaceutical giant. Specifically, the government was moving toward allowing Medicare to reimburse for obesity drugs like those produced by Lilly. The disclosures show 7 separate purchases of Lilly stock starting in early January. During this same window, the Centers for Medicare and Medicaid Services proposed a pilot program that would cap the cost of these GLP-1 drugs at $50 a month for seniors. This move was a major milestone for the company, which is currently valued at nearly $1 trillion. The trades also included investments in West Pharmaceutical Services, a company that manufactures the injectable devices used for these specific weight loss medications.
The optics of these trades are certainly drawing scrutiny, as the president's signature appears directly on the disclosure forms. While the forms provide ranges rather than exact figures, the pattern of investment aligns closely with significant regulatory shifts. For instance, the deadline for manufacturers to join a Medicare pilot program was January 8th, just 2 days after Trump's first stock purchase. Eli Lilly has since confirmed its participation, calling the program a significant milestone for patient access. Beyond the pharmaceutical sector, the disclosures show a broad range of investments in tech giants like Microsoft and Nvidia, as well as household names like Target and Chipotle. However, the healthcare trades stand out because of the direct intersection with active executive branch policymaking. While the Department of Health and Human Services and Eli Lilly have declined to comment on the specifics, the timing of these financial moves continues to raise questions about potential conflicts of interest.
Next, a fasting study. Scientists at Queen Mary University of London have provided a fascinating look at what happens to the human body during a 7-day water-only fast. While many people use intermittent fasting for weight loss, this study tracked thousands of proteins in the blood to see the deeper molecular changes. They found that the body doesn't just switch from burning glucose to fat, it undergoes a massive internal transformation that affects almost every organ, including the brain. Interestingly, the most significant health-related changes didn't actually show up until after the 3rd day without food. This suggests that shorter fasts might not trigger the same level of cellular repair or metabolic shifts that longer periods do. The researchers monitored 12 healthy volunteers and used advanced technology to observe how 3,000 different proteins responded. This level of detail helps us understand why fasting has been linked to various health benefits throughout history, from improved metabolism to enhanced immune function.
What is really exciting about this research is the potential for future medical treatments. By identifying the specific proteins that change during a long fast, scientists hope to develop drugs that can mimic these positive effects without requiring someone to actually stop eating for a week. The study showed that while the body enters a different biological state after 72 hours, these changes are widespread and systemic. It highlights how humans evolved to survive periods of food scarcity by fundamentally altering our internal chemistry. Beyond just burning stored fat for energy, the body seems to prioritize certain repair processes and shifts in the immune system that only kick in when the fast is prolonged. This work provides one of the clearest pictures yet of the molecular landscape of fasting. It moves the conversation beyond simple calorie counting and into the realm of precision healthcare, showing exactly how our organs adapt to extreme nutritional changes.
Now to Alzheimer's research. In a major breakthrough, researchers have used nanotechnology to reverse Alzheimer's-like symptoms in mice. Instead of trying to fix damaged neurons directly, this new approach focuses on the brain's natural waste-clearing system. They developed smart nanoparticles, described as supramolecular drugs, that help repair the blood-brain barrier. This barrier is a critical network of cells and vessels that regulates what enters and leaves the brain. In Alzheimer's patients, this system often breaks down, allowing toxic amyloid proteins to build up and damage brain function. By restoring the integrity of this barrier, the nanoparticles essentially rebooted the brain's ability to clean itself. The results were quite dramatic. Elderly mice treated with this therapy began to behave like healthy younger mice in cognitive tests. This suggests that focusing on the vascular health of the brain might be just as important as targeting the plaques themselves, offering a fresh perspective on treating dementia.
The scale of the brain's energy needs is truly staggering, consuming about 20% of the body's total energy. To support this, the brain relies on a dense network of roughly 1 billion capillaries. This study reinforces the idea that vascular damage isn't just a side effect of Alzheimer's, but a primary driver of the disease. When the blood-brain barrier fails, the brain's cleanup crew can't do its job. These bioactive nanoparticles are designed to intervene at that specific point of failure. The international team, led by scientists from Spain and China, published their findings in the journal Signal Transduction and Targeted Therapy. While we are still a long way from human trials, the ability to restore a natural biological process, rather than just masking symptoms, is a significant step forward. It opens up a new frontier in nanomedicine, where particles aren't just delivery vehicles for other drugs, but are the active treatment themselves.
Moving to hospital boarding. A heartbreaking trend is emerging across the United States where children are remaining in hospitals for months after they have been medically cleared for discharge. This phenomenon, often called a social stay or hospital boarding, happens when there is no safe place for a child to go. We heard the story of a teenager in Illinois who became paralyzed after a shooting. His family struggled to meet his complex medical needs at home, and after his grandmother passed away, he became a ward of the state. Because there were no foster homes equipped to handle his care, he remained in a St. Louis Children's Hospital long after his infection was treated. This isn't just an isolated case, it's a national problem affecting states like Missouri, Minnesota, and Georgia. Hospitals are becoming default holding stations for children with mental health issues, physical disabilities, or chronic conditions that require specialized equipment and constant supervision.
The strain on the foster care system is a major factor here. We've seen reports of foster kids being housed in casino hotels or state offices because there simply aren't enough beds. When you add complex medical requirements to the mix, the options disappear almost entirely. Pediatricians are warning that staying in a hospital without medical necessity can actually be harmful to a child's development and mental well-being. These children are stuck in a limbo where they aren't sick enough to need acute care, but their needs are too great for the available community resources. It's a systemic failure that leaves families feeling desperate and hospitals overwhelmed. In some cases, parents are even accused of neglect when they admit they can no longer provide the level of care required at home. Without a significant increase in home health aides and specialized foster placements, these social stays will likely continue to rise, leaving vulnerable children trapped in clinical settings.
Next, the fiber trend. Social media is currently obsessed with a trend called fiber maxing, and for once, health experts are actually on board. While fiber has traditionally been seen as a boring nutrient, it is finally getting its moment in the spotlight as a health powerhouse. Most Americans are severely deficient, getting only about 10 to 15 grams a day when the recommendation is closer to 25 or 38 grams. Nutrition professors note that increasing fiber intake can significantly reduce the risk of obesity, cardiovascular disease, and type 2 diabetes. It also plays a crucial role in lowering the risk of certain cancers, particularly colorectal cancer. Beyond digestion, fiber is the primary fuel for the trillions of microbes in our gut. These microbes influence everything from our immune system to our mood. So, while the term fiber maxing might sound like just another TikTok fad, the underlying science supports it as a legitimate way to improve long-term health and even longevity.
It is rare to see a viral trend align so perfectly with clinical recommendations. Registered dietitians are excited to see people finally paying attention to this unsexy nutrient. Fiber helps manage blood sugar levels by slowing down the absorption of sugar, which prevents those energy crashes we often feel after a heavy meal. It also keeps you feeling full longer, which is a natural way to help with weight management. The beauty of the fiber maxing trend is that it encourages people to look at their meals through the lens of what they can add rather than what they should restrict. By focusing on whole grains, legumes, fruits, and vegetables, people are naturally improving their overall diet quality. Experts suggest that even small increases in daily fiber can have a measurable impact on heart health and gut function. It is a simple change that addresses a widespread nutritional gap in a modern diet, making it a trend that is definitely worth the hype.
Now for coffee news. For years, people with high blood pressure have been warned to stay away from coffee, but new research suggests the relationship is more complex than we thought. While it is true that caffeine can cause a temporary spike in blood pressure by stimulating the heart and tightening blood vessels, this effect is usually short-lived. This is especially true for regular drinkers who develop a tolerance to the stimulant. Large-scale studies involving hundreds of thousands of people have found no strong evidence that moderate coffee consumption actually increases the risk of developing chronic hypertension. In fact, coffee contains natural compounds and antioxidants that might actually help blood vessels function better over time. For most people, the key is moderation rather than total avoidance. A healthy blood pressure reading is typically below 120/80, and while coffee might nudge those numbers up for an hour or two, it doesn't seem to cause long-term damage to the cardiovascular system.
It is important to understand that hypertension is often a silent condition, affecting about 31% of adults, many of whom don't even know they have it. Because it can lead to heart attacks and strokes, managing it is vital. However, the fear that a morning cup of joe is the culprit might be misplaced. Genetics play a huge role in how we metabolize caffeine and how our brains respond to it. Some people are naturally more sensitive and might experience a more pronounced jolt to their system. But for the average person, coffee is one of the most popular drinks in the world for a reason, and its health profile is generally positive when consumed in moderation. Instead of cutting out coffee entirely, doctors suggest focusing on overall lifestyle factors like diet and exercise. The natural compounds in coffee beans may even offer some protective benefits for the heart and kidneys, making that daily ritual a bit less stressful for the health conscious.
Next, sleep and scrolling. A new study has identified a predictable and damaging behavioral loop between poor sleep and endless video scrolling. Researchers found that daytime tiredness acts as a gateway symptom, making people much more vulnerable to losing control over their social media consumption. When we are tired, our self-control weakens, making it harder to resist the highly engaging algorithms of short-form video platforms. This creates a cycle. You scroll because you're tired and looking for an easy distraction, but the blue light and mental stimulation from the videos keep you awake even longer, worsening your exhaustion the next day. The study, which surveyed over 6,000 college students, found that this behavior often serves as a form of escapism. People use these brief clips to dodge daily responsibilities or emotional stress, but the deep state of absorption makes them lose track of time entirely. It's a modern challenge that is fundamentally disrupting natural rest cycles and mental functions.
The design of these platforms is specifically engineered to lower the mental barrier to entry, promoting continuous viewing that is hard to break. While medical manuals don't yet recognize short video consumption as a formal psychiatric disorder, mental health professionals are increasingly treating it as a significant behavioral problem. Users often report feelings of withdrawal when they are away from their phones, similar to other forms of addiction. This research is unique because it breaks down sleep disorders and video habits into specific symptoms rather than broad categories. By mapping exactly how insomnia leads to specific viewing patterns, scientists hope to develop better interventions for digital wellness. For students and young adults, the 3-month interval used in the study shows that these aren't just temporary bouts of late-night scrolling, but chronic issues that affect physical endurance and emotional regulation. Breaking the loop requires addressing both the sleep hygiene and the psychological drive to escape into digital content.
Finally, the Ebola outbreak. There are growing concerns about a group of Americans in the Democratic Republic of the Congo who may have been exposed to Ebola. Sources indicate that several individuals had high-risk exposures during the country's latest outbreak, and at least one person may already be showing symptoms. The U.S. government is reportedly working on a plan to evacuate these individuals so they can be safely quarantined and treated. While it is not yet clear if they will be brought back to the United States, there has been discussion about transporting them to an American military base in Germany. The CDC has confirmed it is coordinating the safe withdrawal of a small number of Americans directly affected by the outbreak. This particular outbreak has already seen 10 confirmed cases and over 300 suspected cases, with 88 deaths reported so far. While it is not as large as the devastating 2014 epidemic, the World Health Organization has declared it a public health emergency.
The situation is highly dynamic and official information has been limited. During a recent news conference, CDC officials declined to provide specific details about the exposed Americans or the exact extrication plans, citing the need to protect individual dispositions. However, the urgency is clear, as the outbreak has already claimed the lives of at least 4 healthcare workers in the DRC. The CDC is currently assessing the needs on the ground and deploying experts to assist with the international response. Ebola remains a severe threat due to its high mortality rate and the complexity of containing it in regions with limited infrastructure. The fact that the U.S. is moving to extract its citizens suggests a high level of concern regarding the potential for further infection. As we wait for test results for those involved, the focus remains on preventing a wider spread and ensuring that those with high-risk exposure receive the highest level of biocontainment care possible.
That wraps up our briefing for today. Thank you for joining us for these important updates. We will be back tomorrow with more stories. Have a great day.